When we think about aging, we often assume that death happens suddenly. But in reality, the body usually gives quiet warnings, sometimes months, even a year in advance. The problem is, these signs are easy to miss because they seem small at first. Only when looking back do families realize the clues were there all along, but by then, it's too late to prepare or make those last moments truly count. Understanding these early signs can help you provide better care, create meaningful memories, and ensure your loved one's final stage of life is filled with dignity, comfort, and peace. In this guide, we'll cover 5 key signs that often appear in the last year of life. Some may be things you've noticed but brushed off as just part of aging. Others might seem minor but actually signal deeper decline. 1. Significant weight loss. One of the earliest and most telling signs that a person may be in their final year of life is unintentional weight loss. At first, it might not seem like much, a belt that suddenly needs tightening, looser clothes, or a fading appetite. Many families assume this is just part of getting older, but the truth is, losing weight without trying is rarely a good sign. The body may no longer absorb nutrients efficiently, muscle mass may decrease, and essential systems may begin slowing down. If your loved one is eating less, feeling weaker, or struggling to stay active, pay attention. While trying to increase their calorie intake may seem like the right solution, sometimes the issue goes deeper. The best approach is to focus on comfort, easy-to-eat foods, and hydration to maintain their quality of life. 2. Extreme fatigue and weakness. If your loved one is experiencing deep, persistent fatigue that doesn't go away with rest, it could be a sign that their body is conserving energy. Unlike normal tiredness, this exhaustion makes even simple tasks feel overwhelming. Getting out of bed, walking across a room, or even holding a conversation may seem like too much effort. This level of fatigue isn't just about aging, it happens because the heart doesn't pump as efficiently, circulation weakens, and muscles don't receive the same oxygen they once did. You may notice your loved one sleeping more, needing longer naps, or withdrawing from conversations and activities. Instead of pushing them to be more active, allow them to rest when needed and focus on making their remaining time as comfortable as possible. 3. Increased confusion or withdrawal. Changes in cognitive function are another key sign. Someone who was once sharp and engaged may start forgetting things, struggling to follow conversations, or becoming easily disoriented. Even without a history of memory issues, they may repeat themselves, forget names, or lose track of time. This happens because circulation to the brain slows down, leading to cognitive decline. Your loved one might also emotionally withdraw, talking less, seeming uninterested in social interactions, or spending long periods in silence. It's not that they don't care, it's that their brain no longer processes emotions and engagement the same way. The best way to support them is to be patient, speak gently, and create a peaceful, familiar environment. 4. Frequent infections and slow healing. As the body winds down, the immune system weakens. You may notice your loved one catching colds or infections more often, and their recovery taking longer than usual. Even small cuts or bruises might heal much slower. Common infections in the final year of life include pneumonia, urinary tract infections, UTIs, and skin infections. If antibiotics seem less effective or multiple rounds of treatment are needed, it may be because the body is losing its ability to fight back. Instead of aggressive medical interventions, focus on hydration, skin care, and keeping them as comfortable as possible. 5. Changes in breathing or circulation. One of the most noticeable physical changes is in breathing patterns. You may see your loved one breathing more slowly or shallowly. Their breathing may become irregular, with long pauses or alternating between rapid and slow breaths. Some people develop a pattern known as Cheyne-Stokes respiration, where deep breaths alternate with periods of no breathing. Circulation also weakens. Their hands, feet, nose, or ears may feel cold to the touch. Their skin may appear pale, bluish, or mottled, especially on the fingers and toes. These changes mean the heart isn't pumping as strongly, and the body is prioritizing blood flow to vital organs. Some people also experience more shortness of breath, even minimal movement can leave them winded. They may start sleeping propped up to make breathing easier. If you notice these changes, the best thing you can do is offer reassurance and create a calm, comforting space. Recognizing these 5 signs, weight loss, fatigue, cognitive decline, frequent infections, and breathing changes, can help you prepare for what's ahead. These changes don't always happen all at once, and they may not be obvious at first. But when you start noticing them, it's a sign that the body is gradually slowing down. For families, this can be difficult to accept. It's natural to want to fight against it, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. This is a time for cherishing moments, sharing stories, and ensuring they know they are valued and loved. You are not alone in this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for taking the time to learn about these important signs. If this guide has helped you, consider sharing it with others who may benefit. The more we understand, the more we can provide love and comfort when it matters most.